All right. This is the impacts of COVID-19 on Hispanic or Latinx Americans. And it has been almost a year, or a little over a year actually, since COVID-19 hit pandemic levels. And what a year it has been, for sure. I'm sure we all remember that March when the mandatory quarantine went out and a lot of businesses closed, a lot of classes, school, sports got put on hold, and stress was at an all-time high for a lot of people, and it's crazy how we got here, yeah. We want to look at why Hispanics in particular have been hit quite hard by this pandemic. And so if we look back to when a lot of those businesses shut down, we see that Hispanics, in order to make ends meet and in order to pay for housing and other things, they would work those extra shifts and take on those essential jobs in order to provide for themselves. But they don't have a lot of that extra money to access health care. We see that they kind of prioritize their income and their housing over their own health. And because of that, we see that they are more likely to have pre-existing health conditions, which put them at greater risk of COVID-19 death or just worse symptoms in general. Now, using the most recent data from the CDC on March 22nd of this year, we see that Hispanics make up about 1/5 of all cases for COVID-19, which is a little higher than their 18% of the population. But when we see that they account for about 27% of all COVID deaths, that's much higher per age group and racial or ethnic group than any other group, except for blacks or African Americans, but definitely much higher than their white counterparts if we take a sample of 100,000 in that population. Now, there is a potential explanation for that when we look at these barriers here. Characteristics of the Hispanic American population. Hispanics are very family oriented. They're likely to live with a large family, not really able to isolate from each other. And as we all know by now, that causes complications with the COVID-19 pandemic. So we can see how it only takes one person, say the dad has to go work this extra shift every day, has to take public transportation, doesn't speak English as his primary language, and is therefore not able to understand safety precautions. And then he goes home to his large family, and we see that it doesn't take much for the virus to spread among him and his family, and then potentially to the community around him. And then when we add in things like job loss, where 6 in 10 Hispanics experience job loss or pay cuts, and we see that a lot of them are not able to provide for themselves financially, and a lot of them experience evictions or foreclosures, which increases that insecurity and further inhibits their ability to access healthcare. And so it's kind of a vicious cycle that COVID-19 has on them. And then, not to mention the mental health, which has only been exacerbated by the pandemic. They're not able to really treat that as well as they were before the pandemic. And so in conclusion, we see that the Hispanic population has been hit hard by the COVID-19 pandemic. It's had devastating effects on the Hispanic communities across the country. And when we look at potential solutions in order to kind of mitigate these effects, we can help ensure accessibility for uninsured and maybe have more flexible work schedules that they don't have to work those shifts as much, and provide them resources that can provide for financial relief, tailor health education for them so they're better able to understand those precautions, and provide healthcare outreach for these populations that they're able to access at all hours. Otherwise, the COVID-19 pandemic can affect them even further into the future, and it may be hard for them to recover from this.